Hello viewers, this is Ç0V Network TV, a place where you can get the latest information about Nigerian news and out the news in details. President Muhammadu Buhari orders to take coronavirus vaccine on live television. The federal government has said President Muhammadu Buhari, Vice President Yemi Osinbajo, the Secretary to the Government of Federation, Boss Mustapha, and other prominent Nigerians will be among the first set to receive COVID-19 vaccine on live television to help drive awareness. Recall that United States President-elect Joe Biden had December last year received a COVID-19 vaccine on live television in a demonstration intended to encourage Americans to receive shots of their own when they came. Israel Prime Minister Benjamin Netanyahu was also vaccinated against the coronavirus on live television Saturday, becoming the first Israelite and one of the world's leaders to be inoculated. The Executive Director and Chief Executive Officer, National Primary Healthcare Development Agency, Faisal Shuaib, made this disclosure at the Thursday briefing of the Presidential Task Force on Novel Coronavirus COVID-19 Pandemic. He appealed to Nigerians not to be hesitant on the vaccine when they arrive, as key government officials like President, Vice President, and the SGF will take heat on live TV. In terms of the importance of vaccines and strategic countries' leadership, the primary healthcare agency boss said what it means that on Tuesday, I had mentioned that we would like to see a situation where Mr. President, the Vice President, the SGF, critical leaders come and take the vaccine in full glare of the public to demonstrate that this vaccine is safe. So we have to make provisions for that. But even in the developed countries, what we have seen is that apart from the prioritizations health workers, you have to also identify critical leaders that you don't want them to be wiped off by the virus. For example, in warfare, if you want to destroy your enemy, you look for specific leaders, captains, the generals. Once you decapitate them, then the soldiers will become weak. So as much as possible, you do not want to also leave your leaders vulnerable to COVID-19. It doesn't mean you want to prioritize politicians. That is not correct. I emphasized during the last briefing that we will prioritize our health workers because they are the ones in direct contact with cases in isolation units. On the infection herbs health immunity, he said there is no shadow of doubt, even from the different vaccines that we have been used in the past. That is always better to use the vaccines for COVID-19. It will approximately 10 years for you to be able to achieve herd immunities. So you can imagine how many people would have died if you have to rely on herd immunity. The Swiss tried herd immunity, and I'm sure of you go through information that is available. For a lot of people, herd immunity just doesn't work. The Americans touted it, and see what is happening in the US. Herd immunity is not the way to go. The evidence is there that when you use vaccines, you are more likely to quickly attain herd immunity, protect more people. So I would like to reiterate that you must not give way to conspiracy theories. We must try to manage the information around the vaccines. Where people do not understand, please reach out to us, those who are scientists, public health experts. All of us here are Nigerians who take the issues of the safety of Nigerians seriously. Really? So federal government takes the issues of Nigerians seriously? I don't believe that. Shuaib had earlier on Tuesday said Nigeria hopes to get 42 million COVID-19 vaccines to cover 1/5 of its population through the global COVAX scheme. Church explaining that the initial vaccines would come as part of Nigeria's plan to inoculate 40% of the population this year and another 30% in 2020, with 10,000 doses of the Pfizer vaccine arriving by the end of January. The COVAX scheme was set up to provide vaccines to poorer countries such as Nigeria, whose 200 million people and poor infrastructure pose a daunting challenge to medical officials rolling out the vaccinations as the West African country battles a second larger spike in coronavirus cases. And meanwhile, the Minister of State Health, Olorunimbo Mamora, has warned Nigerians against complications in containing the COVID-19 pandemic in the country, saying the vaccines against the virus may not arrive in the country too soon. Mamora, represented by the Director Hospital Services, Federal Ministry of Health, Dr. Adebimpe Adebiyi, said that though government is working very hard to get vaccines for the people, it may not come so early enough. And therefore, we need to be alive to get the vaccine when they come. I have brought this up to underscore the importance of compliance with non-pharmaceutical measures as advised to reduce the transmissibility of the virus, he said. She said. She added that as of Wednesday, new cases recorded were 1,354, with one death recorded, while total number of cases tested is 1 million people. Wow. Number of confirmed cases is 94,369. Active cases stand at 15,764. Discharged cases till date are 72,299. Number of deaths till date is 1,324, with case fatality rate of 1.4%. The federal government is determined to ensure morbidity due to COVID-19 is reduced to the barest minimum while improving on the fatality rate. Appropriate measures are being taken to achieve these objectives, she said. Adebiyi said that a second phase assessment of the isolation and treatment centers countrywide to verify challenges is to be carried out immediately to enable government to provide appropriate interventions measures required to strengthen these centers. We continue to appeal to states to increase testing and contact tracing. The cooperation of the states with the federal authority is critical to our collective objectives of defeating COVID-19, she added. So guys, what do you think about this? What is your own take about the decisions that is being made by the federal government, saying that President Muhammadu Buhari and others to take coronavirus vaccine on live television? You know, I don't believe these people. You know why? The reason why I don't believe them is just that sometimes they might camouflage, thinking that they took the virus and at the same time they did not take the virus. At the same time, they did not take the virus. That is the reason why I don't trust them. They might camouflage, they might pretend as if they took it. And that is where the problem lies. I'm telling you the truth. So this vaccine of the stuff, there are more to it. But many people do not have a choice of taking the vaccine because, especially the people that are working in the hospital, the healthcare workers, the forefront healthcare workers. You know, at the end of the day, they will make it very important to all workers to take the vaccine. May God help us. Because recently, what is going on worldwide, only God understands. So guys, what do you think about this? What is your own take? Kindly drop your comment at the comment section below. For those who subscribe, we want to say a very big thank you to you for subscribing. We say God bless you. And if you're here to do so, kindly press the subscription button below. And also, please don't forget to press the notification button for more details about our news. God bless you. Stay safe.